The United States in the past 7 days in the year 2021 has recorded over 2 million cases of the coronavirus infections. It's amazing. During the discovery of the vaccines, it is estimated that the distribution and the vaccination should be able to meet a 20 million vaccination project. As of now, the United States have been able to vaccinate close to 6 million people, way below expectations. Are we losing the fight against coronavirus? United States has recorded 4,000 deaths, the highest in a daily death toll in the history of this pandemic. Michelle, are we on course or we are losing the fight against this pandemic?
I think we're on course. These things take time. That's one thing. These things take time. Manufacturers are working hard to get those vaccines pushed out. And we also have to remember that the vaccines are not mandatory. They won't force anyone to get the vaccines. However, essential workers, healthcare employees, long-term care residents, they want them to get vaccinated first. So right now, that's what we're focusing on. The CDC is in that phase 1A approach where they're trying to target these populations. And of course, they'll promise these big numbers, but we do have to remember, like I said, these things take time. And I do believe that we are on course because last year, around this time is when coronavirus was in China, started hitting other countries. And we didn't know much about the vaccine at that point. Or, I'm sorry, about the coronavirus at that time. But right now, we know more than we did. Okay. And at least now we have 2 vaccines that have EUA approval that are approved by the FDA now for us to use during this time. And hopefully throughout the year, there will be more. There are other companies still wanting to get their vaccine out, and they're also trying to go for EUA as well so that their vaccines can be used. So I think the more manufacturers we get to provide us with the vaccine, the more people we can target, at least in America. We can definitely target more people.
I know you'll be wondering who she is. This is Michelle Braimah. She's a young lady and she's working in the office that sees to the distribution of the vaccine of coronavirus in the state of Ohio. She has a Ghanaian background, and that's why we brought her to our studio so we could celebrate her, because frontliners are out there sacrificing their lives and to ensure that you and I are safe. And now that there's a vaccine, this lady is also putting her job on the line, her life on the line to ensure that you and I will be vaccinated. Michelle, yeshe sena adiene kona. You have said, sir, it's obvious we are making progress. But there have been this myth about the whole vaccine thing. First of all, tell us, your office, what exactly do you do with the project? Because you sent me some details of the work that you do with the program that you've done, looking at the Operation Warp Speed from the national project itself. And it descends down to Monsomo side. In the Momo office, what do you do? Because a bit of children and all that. So what exactly do you do with your office distribution of the coronavirus vaccine?
So my office is the Ohio Department of Health. And then I'm specifically more in the Bureau of Infectious Diseases. We have different bureaus. And then under that, I'm in the Immunization Program. And then under that, I'm in the Vaccines for Children program. And what my job normally entailed was vaccines for children. And in America, there's a big issue with the underserved population to get their vaccines. Children from 0 to 18 who have Medicaid or they're uninsured, they may be underinsured. Also American Indians, Alaskan Natives. And the vaccines we provide are all the childhood vaccines, and it's provided to them for free. So I say for free because it's through taxpayer money. The taxes we pay is what funds this project, and it's a nationwide project with the CDC. So it was new to me. I don't have a background in immunizations until I started working here. And right now, due to coronavirus, we're all at home. we don't.
But you
go.
have a master's degree in public health.
Yes, I have a master's degree in public health from New York University, and I'm also a certified health education specialist as well. And so prior to working in immunizations, I was doing like maternal health back in New York. And now that I'm in immunizations, because of COVID, I'm not able to go out into where I
You majored.
not where I majored, but where I normally go out to see my provider. So we split up Ohio into 10 sections, and all of us have different territories. And I serve the Cincinnati, that area, Hamilton and Butler County. So because of COVID, we can't go out to our territory, so we're all stuck at home. And then of course, we're in immunizations. And it took me a while to realize like, oh, I work in immunizations. So we've been working on the COVID response. In the beginning, in March, I was doing a lot of the call center in Ohio, where we were taking in phone calls from the public. They were concerned about COVID. They didn't know like what to do. Can they go out? If my neighbor is coughing, can I, like, people were just obviously, the volume was so big that they were taking so many volunteers from our job to man this call line. And the call line is still active. And people still call in. I do it whenever I have the chance, and people still call in and ask questions. First, it was more about COVID, and now it's geared toward about the vaccine. So right now, my specific department, me and my team, we work on enrolling providers for the COVID vaccine in Ohio. And we also do some policies regarding the storage and handling of at least the 2 vaccines that we have now. So we work on policies with that. We're enrolling providers, we're enrolling pharmacies, long-term care facilities, as many people as we can, or as many providers as we can, so that they can also start getting the vaccine as well.
What is the target? Because we know from the onset, and Dr. Anthony Fauci actually spoke about the target. What is the target for Ohio? Because the country was looking about 20 million. What is the target for the state of Ohio?
Sure. So I don't have a specific number.
Okay.
But for Ohio, we're trying to enroll any and every provider.
As many as you can.
As many as we can. Pharmacies, your pharmacies down the street, your mom and pop owned pharmacies, long-term care facilities, home health agencies, medical offices, hospitals, local health departments, anywhere we can. They're able to go into our system and try to enroll in our program, and then we just go through the application, and then we get them in the program, so that when the vaccine comes at large and we can start vaccinating everyone, you and I, we're ready for it. They're ready in the system. They know what to do. They have the information, so that when the vaccine comes, they're ready to go.
So you're already if I should understand, it's more like an orientation. I say more prepare all those people for the vaccination.
Yeah. So what we're doing is just preparing them for when the vaccine comes out. And TMO more information about the Moderna vaccine, the Pfizer vaccine. Yatra almost said this is the type of needle you will use. Yatra almost said this is the target, like the population, phase 1A, 1B, 1C. And also we're giving them access into ES system in Ohio. Say, yeah, well, vaccine, then you're in our statewide system.
Okay.
And we want all providers to be in our statewide system. That way, it'll be my vaccine. We know say it's in the system within 24 hours. Then say the second dose will be due on this time. Sure. That will be out on a record. Say, yes, I got the COVID vaccine, and specifically Pfizer or Moderna, or if we get more as well. So right now we're just trying to get them in. And at this time, the hospitals, they have the Pfizer vaccines, and we're also local health departments as well. And any like healthcare provider who is not affiliated with a network, they can also go to their local health department and get the vaccine as well for them and their staff.
Wow. Wow. So, Michelle, a quick one. You share Senna vaccine there have been so many allegations, misinformation, misunderstanding, myth, and all that. How is your office educating people for them to understand, sir, this is not, because we've heard the spiritual aspect of it, we've heard the conspiracy theories, all these things come into play. And I know it's a huge challenge to your office specifically, trying to make people understand. How are you able to convince them? What is the kind of orientation are you giving to people?
Okay. So right now, like Okoya websites, we have about like facts and myths about the coronavirus and also the vaccine. And a lot of people feel that the vaccine, it was done too quickly. That's something that people tend to say, that it was done too quickly. But the technology they used for the COVID vaccine, the mRNA, that has been there for a while.
Yeah.
Until now, no, at least this vaccine. Also, another thing that people think is like, oh, like COVID may be a vaccine. Because if you look at some other ones, they're live vaccines. But this COVID vaccine, there's no weakened or live COVID virus in the vaccine. Nina, the mRNA technology, which helps your body to produce antibodies and prepare if you were to get COVID, at least, because people feel so, okay, send me what vaccine I mean, COVID, but that's not how vaccines work. It protects you. It's if we all get the vaccine, then we build that herd immunity. But I understand not everyone wants to get vaccinated, and that's something that I want people to understand, that the vaccine will help save lives, but I also understand that no be an emphasis on what vaccine.
And you're mandatory.
It's not exactly.
Okay.
So the more people who vaccinate, it will build greater herd immunity to protect the ones that who don't get vaccinated or who can't get vaccinated. Because we also have to remember that Ibinum have some weakened immune systems where they actually can't get vaccinated.
All right.
And no be able to make vaccines. So we have to remember that we need to, the ones who we want to, at least a good majority, we need to get vaccinated. And the worst side effects that it seems like they're seeing, well, not the worst, but the biggest side effects that they're seeing is like, your arm will be a little bit sore, which is normal after like getting a flu shot. And a little pain is good. It shows that the vaccine is working. And so there have been some others who have, worse side effects, which is normal for vaccines. It be like, well, if you have underlying health condition, not call a vaccine, it can exacerbate your health condition. So it's like I've deviated from the question, but my whole thing is we need to get vaccinated.
Okay, so Semeta was here, COVID-19 vaccine, and you're one of those vaccines that has this live virus. What it does is it boosts your immune system so that it can detect the COVID virus. So the body prepares itself to fight it.
Yes.
Okay, exactly. Is that the reason, Tina, it was prolonged? Because and yes, war, then it start, reacting. It takes time.
It takes time. And also, so you need the 2 doses, because I read an article, or it was actually something on WhatsApp, where someone was forwarding and said, oh, because COVID vaccine, the next week,
so many stories
about COVID. But we have to remember that the COVID vaccine, at least for Pfizer, I almost say it's about like 95% effective. But that's after 2 doses. After the first dose, you're about maybe like 50 or so percent protected against the vaccine. And also, just so our vaccine, it doesn't mean you won't get COVID. It will just help your body to, if you do get COVID, you won't get as many severe reactions as if in Kawun shots, So that's one thing people don't understand, that you can still get COVID, but at least it wouldn't be hopefully as worse as people who are on like ventilators, who are dying. It would reduce the symptoms. That's how the flu vaccine works. Because if it's me, I have a flu shot, and you still get flu. I mean, it happens to me sometimes, but it's not as severe, because in the wintertime, I can get so many colds. I get really sick. But what flu vaccine, at least it's reduced me like feeling like I can't move. I'm in bed for days. I'm stuck. Okay. So at least vaccine, it will reduce at least your chances of getting it. And if you do get it, it wouldn't be as severe.
Okay. So we shouldn't be surprised that Obi take a first shot. Then, because normally the second shot, what I read was it takes about 14 to 15 days before you go for the next shot. So during that period, if you don't take the precautions that you are likely to.
Oh yeah, definitely. Until after the first shot, you still should be wearing your mask. Because even after the second shot, you should still wear the masks and promote social distancing. Right. Because again, it's only 95% effective. What about that? Like 5% and 6%. You may be one of those. So we have to remember that just because war shot, you still have to take the right precautions to protect yourself and your family, your friends against coronavirus.
All right. So, now, let me come to you, Michelle. Born in New York, Bronx.
Yes.
growing up, now you are in Ohio,
Yeah.
the different states.
Yeah.
Uh, how has it been for you?
Okay,
You
yeah.
know,
So
from growing up, getting yourself into school, college, university, masters, and all that. Tell us about it.
okay, yeah. So I was born in the Bronx, New York. Well, I'm sorry. Let me retract that because I was raised in the Bronx, but I was born in Bronxville, which is in Westchester County,
okay.
and then right after they took me to Manhattan, and then we moved to Bronx later on, and I grew up there. And
To Ghanaian parents?
to Ghanaian parents, yes. Both my parents are Ghanaian. They're my dad is from the north, and my mom
Which
is
part of the north?
Wa. All
Wa.
I know is that they're in Wa. But like it's specifically like where in Wa Makoho. Like I don't think so. I've been there since I was like very, very young. So like so the Makoho right now, I don't even know
But you've been
where
there
to
before?
go. I've been there before when I was very, very young.
Okay.
And then my
And
mom.
what's a local dialect?
Nope, I didn't see anything. My dad, he didn't teach it to me because since my mom and my dad, like their common language was Tree. So in our house we spoke Tree.
The Trina.
Trina, and then my mom, also she's Fante and Wasa.
Okay.
So, but I understand Fante. If you speak Fante, I understand. But some Canada, I can't.
Dema.
You know.
Okay. All right.
So yeah, and definitely my parents made sure so I understand say I'm Ghanaian, even though I was born here. No matter what, I'm still Ghanaian.
Yeah.
Until like if we spoke Tree, we watched Ghanaian movies, anything Ghana. We went to Ghana. My parents took me to Ghana at a very young age, and then we would go very frequently. Until right now, like you call Ghana, like we normally stay in Takoradi.
Okay.
Until right now, they call Takoradi. I can take you around. I can.
Which part of Takrady?
So all I know is they were like pipe panel. That's how I always say pipe panel. That's what I always know. Into say contact already at least I can make my like me to me market. As I can do shop right. Like I know my way.
Market circle, pipe panel.
Yes.
There's this trouble over there. I don't know if we want.
What did you?
Oh, a pipe panel no ma.
But then
And now who did in the local places?
Oh, I do. I do. There was one lady I know. Oh yeah, like rice and stew, sweet rice. That was my spot. She's right on the corner.
Okay.
But now she moved. But yeah, Ghana. I always eat the Ghanaian food. Like my parents made sure I know who I am. I know the culture. Until like when it comes to the food, I know how to make the dishes. Like I said, I speak the language. Just that it's not as fluent. Until now, like I mix the Tree and the English. You know, because even though I speak Tree, you know, sometimes because of my accent, so I feel more comfortable when I speak it at home. But I do know who I am. I love Ghana. I go to Ghana.
When was the last time you were in Ghana?
I called Ghana last May 2019.
That was last year.
That was
no 2 years ago.
Yeah, now I thought it was last year, but
yeah.
May 2019 was the last time I called Ghana, and that time I stayed more in Accra. So I learned more about Accra, and Accra is hot.
It's busy, eh?
Very busy.
So, which part of Accra were you?
I was near the airport because I stayed in like hotels around there. So I was around near the airport, around East Legon. So I stayed around there, and I really liked it. It was different to experience Accra because normally I call Ghana straight from like the airport near Takoradi. So it's like we'll be in Accra for maybe 1 or 2 days to be with my uncle, and we go straight to Takoradi. But this time it was really nice that I was able to experience more of like the city life, like the hustle and bustle, because it reminded me of New York, like the same exact way.
Yeah. Because Accra, over New York now do Accra, I said, the same thing.
Yeah,
we'll be busy.
Exactly. And New York, so you'll be walking around, no people phone say, hey, we got to buy like, you know, like you hear, and then we and you'll be at Tracy Towers, and you see people doing, you know, cooking their soup. So definitely, I really did love being in Accra. And then we ended up moving to Ohio. And we were here. I did my high school, my college, my undergrad here, and then I went back to New York. So undergrad, I went to University of Cincinnati.
Okay.
And I did just my Bachelor's of Arts in Liberal Arts. It was just a generic liberal arts degree. And then it was there that I found my love of public health. Because growing up, both my parents, they're nurses. But I was never interested in nursing. I was like, I want to be a medical doctor. But then when I went to college, like in high school, I was really smart, but college was really hard for me. So I decided, okay, I'm not going to waste my time and try to go to medical school because I'm a realist. I know it probably won't happen. So let me find out something else in the health field. And who's public health, I can help to prevent these diseases. So let me go into that. And then after school, I came home. I worked at a nonprofit for about a year in Columbus. And then I started to apply to public health schools for grad school. And I got into another school in New York. So me and one of my best friends moved to New York because no, called NYU, and I must call another school. And then literally the day before, like, orientation at NYU, and I'm so, oh yeah, like, you got in. And I was like, oh, okay. So then, and NYU was my dream school from when I was a child.
Wow.
And so I got in there, and if you're in public health, then unim say like NYU get big when it comes to public health.
Can you break down NYU for viewers need to know what NYU is?
Oh, NYU, New York University. Yes, it's a great college. One more branches all over the US. They even have a branch in Ghana, in Accra, where people can take classes there. And even for public health, so we'll call one more program, be able to call like Ghana first semester, you go to like UK first semester, different places. So in public health, and sometimes it's about like the school you went to. It holds a lot of weight in the public health world, is what I've learned. And definitely going to NYU, because NYU is so well known for their global health policies. And I mean, who said, okay, this school is definitely going to boost me up. So I was really blessed to have gone to NYU, because back to Ohio, I was applying for jobs everywhere. And I'm like, I went to NYU. Why am I not getting a job? Like, me apply, well, DC, Georgia, everywhere. And like, I had a spreadsheet, 150 places I had applied to. And then my mom was like, you know what? Stay here. Try and apply for a job here. And I applied for a job after grad school at ODH in Ohio. And I got the job. And like I said, I didn't know anything about immunizations, but a few nights before my interview, I was doing certificates. I was learning about immunizations to understand more about it, because we didn't touch too much on it in grad school, but I wanted to learn more. And then I went for my interview and I got the job, and I've been there for a little bit over 2 years now. And I love my job. Right now in my department, I'm the only Ghanaian there. But before that, Ghanaian back home. But right now, my department, and
you're making Ghana proud with what you're doing.
Thank you. So I just, I want to continue to get into, I love immunizations now. I wanted, first, I was more focused on maternal and child health. And then my mom said, okay, this immunization, it kind of ties into that, because we had the vaccines for children. So I just hope that I can continue to, do great in immunizations. And I always say, like, I want to go back to Ghana. And I want to see, what can I do there? Like, how can I help with immunizations? Me call Ghana, when I was in Takoradi, me and a community health nurse or Takoradi. And
a family of health workers.
Yeah. And I was like, hey, Auntie Amma, can you take me to your hospital so I can see how you guys store vaccines and show it to my friends back here in America? And so we went, they showed me how they store the vaccines, because
what was the difference?
So here, like the places that they would call like Ekrasi or the villages, at least still, those hospitals, like one more, electricity there. They have storage units. They have a way to get the vaccines out to people. But the things I wonder about in Ghana is, one more Ekrasi, and how do they get the vaccines to them? Because sometimes they're so far from the hospital. So my concern was, do they come there? Do you guys take it there? But if you're taking it there, how do you make sure that you're storing it properly? Are you using temperature monitoring device to make sure the vaccine is stored appropriately?
So the transportation, the period from where is just like during the distribution, from the point where the CDC releases the vaccines, it comes to all the agencies, and where it gets to the hospital. That period. Ghana, you are still wondering how it's going to be possible.
That's what I'm really concerned about the logistics, about how they will get these vaccines out, especially to the elderly population in the villages. How? Because you can put it in a cooler and say, it's okay, I'm going to go take it. But are you storing it appropriately? Do you have the freezer packs in there? And you can't just put the freezer packs. Do you have bubble wrap? Do you have cardboard? There's a lot that goes into storing the vaccines properly. And I'm wondering, like, are people as passionate as I am about this? Is that we need to make sure that this is done correctly. And that's what I'm really concerned about, because you don't want to go and inject someone with like just diluent, like there's nothing in there. You want to make sure that you're taking it to them appropriately, because if you just from how I know my people in Ghana, how say I should close my store. Now I'm going to line for the vaccine that I may or may not get. Because what if we say there's too many people, there's not enough vaccines. Like the logistics, we need to make sure that there are enough vaccines for people. We need to start first with the essential workers, the people who are in the hospitals, and then work our way down, kind of follow the model of the CDC and, finally get it out to everyone who wants to get vaccinated. And it's going to take time. When I look at Africa in general, it won't be as fast as here. If I'm just honest, it won't be as fast because I see a lot of people, like you say, saying, so, the spiritual aspect, sharing things on WhatsApp every day. I'm seeing something shared that's completely wrong. So I'm really concerned about the logistics, how we're going to get people to take this vaccine.
All right. When you take a look at what has happened in Ghana during the election year, the videos you've seen, the campaigns, the crowd, the masses getting together, no social distancing, you don't see everybody in a mask. Do you get scared?
I do. I get so scared, but then I think like, wow, Ghana is blessed. Because when I think about if that was done here, the way that so many people would get COVID, but Ghana, and I feel like God has really blessed Ghana. Because the way Mehu said, there's so many crowds, no one is wearing a mask. I mean, even now, I'm living through social media and seeing people in Ghana. The clubs are open every night. Eko Bloomba, Eko Twist, and it's like not a mask in sight.
Despite the president, saying that
yes,
for some of these beaches, the clubs should be closed.
Yes. And so I'm just like, thank God that the cases are not getting as high as I would think.
Is it a case of less testing? Into me in your figures, Nana, because anytime there's a protest, then they go into the mass, testing.
Yeah.
The result, it's outrageous. Is it a case that after campaign and all that, huge testing like what is happening in America? Because in America, for instance, they try as much as possible to have in a day more than 1 million people to be tested. Is it a results now? That scary thing. And I say it's genuinely what you think the people want to believe, that the immune system of people in Ghana are able to fight this virus.
Yeah, I think that people do have that belief. So we feel so, immune system better change like people in the West or whatever the case is. And I also, a couple of weeks ago, I was talking to my mom and I was like, hey, Anna, do people feel so maybe when you're COVID, but we feel so maybe they're malaria? And I'm thinking like, oh my God, so malaria. Because when I look at some of the symptoms, it's almost similar, the fever, the chills and all that. So I'm going to say, maybe I'm malaria. Let me take the malaria pills and I'll feel better, or let me wait it out. So definitely, like, people they won't go get tested because they're like, it's just malaria. So I do feel that people do have COVID, but we feel so, it's something else. And then maybe, again, I don't know the scientifics behind it, but it could be that maybe some of the stuff in these malaria drugs can help to, like lessen their symptoms or like cure their COVID, at least for that time.
Specifically, I was referring to Ghana.
Yes, for Ghana. Because, and then also, again, America is like, over 350 million people. Ghana is about like 22 million people around there or more.
The last check was about 30 million.
30 million, hey. And so again, here, definitely we have to be testing a lot more, because there's a lot more people here. But when it comes to Ghana, the testing, I don't know specifically how that's being conducted. I don't know if you can just wake up and go get a test. Like here in the beginning, you couldn't just wake up and go get tested. Your doctor had to order the prescription and all that. But now there's testing widely available.
Yeah.
When it comes to Africa, I don't know, are they making testing widely available to people to just be like, I don't feel well, let me go get tested. Meaning when people feel, I don't feel well, let me go get tested. No, I can't get tested.
Yeah.
Just like that. Now, is that an option in Ghana? I don't know. That's I would hope it would be, but then again, are people wanting to go get tested? And they feel COVID or it's going down, because I feel like it's not been widely as talked about as before, especially now that, December happened, everyone was going back to Ghana, the borders are open. They're like, that means The COVID is still there. COVID will be there for a long time. At least this specific COVID-19 virus will be there for a long time. So I don't think we'll ever get back to normal. This will be like our new normal.
Whoa.
Yeah, I think that it will be our new normal for a very long time. But not in the sense of like we'll always be scared, especially with these vaccines coming out. But with these like social distancing, I think it'll be there for a long time. Masks will be there for, I think it'll be there for at least a few more years or a couple more years, especially if people don't want to get vaccinated as well. The safest thing is like this mask, it can save lives. So say if you feel you don't want to get vaccinated, just put a mask on. The worst thing that would happen, so because the mask didn't work, is you put a piece of material on your face. That's the worst thing. So I just feel like people need to continue to wear masks, practice this social distancing, and let's try to, bring these COVID numbers down. Right now, like I said, I'm more of a realist. I just feel like we need to start bringing these numbers down, and then see how can we get rid of this? Or will it be something that we can't get rid of? And, we take the vaccine every year like flu. Maybe that's something that manufacturers will tell us more about as time goes on, as more trials are being done.
Okay. Let's go back to your office. Dr. Anthony Fauci actually says something that he believes that the reason why they were not able to meet the 20 million target of vaccination as they projected is as a result of this holiday period. Did you also experience such a thing in your office where because of the holiday period, it was slow getting people informed, educated, vaccinated, and all that? Do you think after this holiday season is actually going to surge?
That because right now, so we're focusing on those healthcare workers, no. Into 1 minute they're told say office never do vaccine, and
it's not mandatory for them, I hear.
It's not mandatory, but it's like bejo vaccine. It's like I don't know if they're saying like unjipe, well just don't come. Because I'm thinking, a good majority of anyone who's in healthcare will want to get vaccinated.
Yeah.
There are still, a few, just because you're in science doesn't mean like, you believe in all science. I know a few people who are in the healthcare who don't want to get vaccinated. So I don't know like hospitals, what their policies are on if you don't get vaccinated, you can't come or you have to wait at home. Like, I don't know what their policies are because it's like with the flu vaccine, if you have well, it's like, okay, what? That's fine, but you have to wear a mask at all times in the hospital. So when I used to work in a hospital, I would always get my flu shot. But others who wouldn't, they would have a mask on, like providers, they would just wear a mask just to protect themselves and anyone else from getting flu. So I don't know if that's how they will kind of do it for COVID as well. And like you said, the holiday season, I don't think it affected as much because as I'm saying, hospital number for us, okay, Brad, number Joe vaccine. And also when the vaccines came to Ohio, I was very lucky. So I went to Cincinnati that day. That so almost been concussion vaccines now, but like what's going on. Until when that happened, I mean like my leadership, yeah, because I said okay. Minimum time now vaccines nearby, like what's going on, trap pictures, all that. And it's funny enough that the vaccines went to OSU first, even though I was close, like near Kentucky, but they went to OSU first. And that day, we posted on our social media a lot, communications. One thing about ODH is I feel like they're really good at getting the communication out. You'll be watching TV and you'll see commercials about like COVID. And I feel like they did really well in, getting people to understand COVID is here. We need to save lives. I think they did a great job on that. Like anytime, I don't have cable, but whenever I watch things that have ads in it and it detects I'm in Ohio, like every other ad is those like different ODH ads saying, we need to, get vaccinated or we need to wear the masks, whatever the case is. But going back to what you said, I don't think there would be a difference after the holiday season. That's just my personal opinion because I feel that in this specific time, like I said, the healthcare workers, you will go to work to get vaccinated. Long-term care facilities, already they're in that facility until they will get their vaccines. Local health departments have the vaccines. They will, say, okay, it will be Braimah vaccine because people call us a lot in our office. No, I say, okay, it's time to me vaccine. Oh, should I go to my network? Oh, like a lot of calls. When I do the call line right now, it's about when am I getting my vaccine? And if I'm in call, like providers even call physicians who are not affiliated with networks like where can I go? Or go to your local health department. Or there's someone like me. When can I get vaccinated? At this time, we don't know when that will be.
Okay. So let's look at something here. Side effects and reactions of the vaccine. Like what kind of orientation will you give someone? Take us through the process.
About the side effects.
Yeah, the side, because we know there's a reaction and there's a side effect. People confuse the two because your reaction does not necessarily mean it's a side effect.
Right.
Yeah, so the difference. Take us through the orientation.
Okay, so I have to think.
Yeah.
So, the side effects of both vaccines, it also, your underlying medical condition, sometimes that can exacerbate the side effects. A reaction will be like, oh, like there was some redness, there was some soreness, which is different than, like I couldn't breathe, or like some organ was not working anymore, or like I have a fever, I have chills for an extended period of time. So, and we also have something called VAERS in America, where if there's a side effect or reaction, you can report it to them. And before, I think I'll call Dr. Hanoma report it, but now I'm not to call. I know I report to say, me vaccine, I got this reaction or I got this side effect. And also, so the CDC has done this this approach. It's called VSafe, where all vaccine area, you can go and register, and then like they'll check in on you, let you know when it's time for your second dose, and you can also report if you've had any side effects or any reactions at all. And on the CDC, it gives a really nice long list of what you can look out for. If you have any of these things, you need to report it to your doctor. So they'll give you a list of all like the side effects, all the reactions, what is normal, what's not normal. And they'll let you know how to report it to your doctor, or if you need to report it to VAERS.
So the reactions sometimes after the vaccine makes you feel weak. You feel that, like you're tired, headaches. But anything beyond these things that these are not normal, that is what we refer to as a side effect.
As a side effect, yes.
Okay. And at what period do you have to call? Because is it after 24 hours, 48 hours? Is it 2 days, 3 days? How? At what period?
That one, I will say that, to be honest, I don't know. But I don't have the information on that. But anything as if like, I believe like if a nurse said like she passed out after she got the vaccine, something like that, I believe they would just say like it's a reaction of the vaccine, because she was okay after. So but that can still be reported to VAERS or to your physician, and they can actually be the ones to determine like, yes, this definitely needs to be reported, or they're the ones to determine, okay, this is actually normal. I would say like, after a few days, if you're still like having a fever, your arm has been sore for weeks, then definitely you want to let your physician know, because that's prolonged. That's too long of a time after the vaccine that you're still getting these effects. It should be something that kind of wears off in about a day or two. Like if you have a sore arm, maybe that first day and it will be sore. Maybe the next day it might be a little bit sore. But after that, it's kind of like, okay, I definitely need to reach out to my physician about this, as they can make the best decision. So we always say, call your doctor. If you don't have a doctor, call an urgent care, call your local health department, and they can be the ones to determine if this definitely is a side effect or if this is just a normal reaction from the vaccine.
The children, specifically your program, how many children has been involved so far? And what is the rate like? Because at some point, I remember some of the directives that were given. You realize that I think some kids around some ages, when they enter in a restaurant, for instance, they not necessarily have to put on a mask and all that. The children, the vaccine, how has it been with your program?
Yeah, so when it comes to the vaccine, the COVID-19 vaccine for kids, it's not approved yet for children. I believe for one of the vaccines, it's children 16 and under cannot get the vaccine, and for another one, it's 18 and under can't get the vaccine. So at this time, the CDC just says it's just not safe for children. So anyone over 18 can get the vaccine, but anyone less than 18 right now, it's just not safe for them to get it. The same for like pregnant or breastfeeding women. They say that you may choose to get vaccinated, but they don't have enough information on that. So when it comes to the kids, it's more like, making sure that they're wearing their masks. And they always say kids under 2 shouldn't wear a mask. But I have seen some people putting like really small masks on their kids. Definitely wanting to provide social distancing, and trying not to get them in large gatherings. I understand a lot of kids, they're having birthdays, it's a great time, but I really feel like the risk is too great to have like birthday parties like for little kids. They're running around, no masks on. Parents are also there. They feel like, oh, I know you, oh, you did. We go to church together. So they get comfortable. They're letting me take my mask off too. And then there's no masks. There's kids running around, and these kids are very vulnerable to the disease because they don't have protection like us as adults we do. So when it comes to kids at this point, it's just making sure to, keep them at home, no large gatherings for them. If they're old enough to wear a mask, they should be wearing a mask if you're taking them out, as well. And I hope at one point we will start to learn more about like maybe some manufacturers will start working on some vaccines for these kids as well.
After the last quarter, during the last quarter of last year, 2020, then came the announcement of the discovery of the vaccine by Moderna, and then we also heard of the Pfizer. Has it reduced that fear factor? Has it reduced that? Because the people you talk to, you are out there, you are talking to people, you are educating, orienting, and distributing the vaccine. Has it reduced that fear factor, or people are still in that fear jackets?
Well, I think that definitely has given people hope that at least we've been able to come out with these vaccines. When it comes to fear, definitely I think people are still scared. From the calls I take from people in Ohio, people are scared. People want to get the vaccine, and there are people who definitely don't want the vaccine. As we say, like they're anti-vaxxers. All these things. Why should I put something in my body?
Because of Nemo.
Yes. So definitely, I feel like it has given people a lot of hope, but the fear is still there because, people are still dying from COVID every day. There are more and more deaths. So it is scary. Like that fear, it's still there. In the beginning, like I was like, okay, COVID is here. COVID is real. And I knew, people were dying from COVID. I definitely understood that aspect, but I don't think it really hit me until I started learning that people I know are getting COVID. Because when someone someone you love, like, hey, this is really serious. Like, God forbid if they have to go to the hospital, they have to be put on a ventilator. You get more scared.
That's where it hits you.
That's where it hits you. So sometimes in the beginning, I was like, I don't blame people for thinking, oh, it's no real, it's not, because it hasn't hit their family member or a loved one. It's like, they may not be empathetic. They don't feel it. So definitely now that more and more people are getting it, like just recently when I was telling my coworkers, oh, minimobia when you be also, oh, finally, like now someone, because it's like, late in the game now. And thank God, like none of my family members have gotten COVID. At least let me say that we know of. Make sure to social distance. Like we don't really go out to parties, people's houses, weddings, all those things, because you want to be safe. Let's stay home. I'm a proponent for let's shut it down. Let's lock it down for a couple more months and figure out what can we do. Let's work on more vaccines. Let's work on getting more masks out to people. At least now there's so much hand sanitizer. There's so much like Lysol wipes, Clorox wipes. Like we're finding ways that at least we can try to make ourselves protected against the vaccine.
Yanko Ghana finally, and then it's a wrap. Will the vaccine ever get to the country, Ghana?
I hope.
You hope?
I hope, because I have been seeing, again, some things going around saying that vaccine in Africa until like 2023, 2024. I've been seeing, and I'm like, I don't know who made these figures up. There's nothing to show. So like, was it from WHO? Was it from here? What I realized is when it comes to like these countries now, it's like definitely almost like they focus like the higher income countries. No, it's like every man for himself. And so right now, the man focus is that we need to get it to US, UK, Canada, Australia, those big countries.
Is it not as a rate of the numbers?
It's definitely as a rate of the numbers, but also, why are we not making plans for the ones who to get the vaccine? Because over to South America, even though we haven't had a pandemic for like decades now, still, sikawaho. Women say we need to allocate this amount of money because you never know, at one point we're going to need this money for a pandemic. But some of the lower income countries, they may not have access for that money. Until we to say Pfizer, they're a company, one pesika, like there's their business, that's how they make their money. Into himself, America, and I say UK, because okay, here's an X amount of money, fire vaccines, no. But how can a low income country be like, here's millions of dollars, million money? And so I know that like WHO, like Gavi, they're trying to do in a way at low income countries and lower middle income countries, and Ghana has been identified as a lower middle income country, that maybe we can all come together and start to get some funds so that we can work with manufacturers, incentivize them to also bring us the vaccines as well. And at this time, out of those 92 countries, now about 80 of them have written interest, say yes, we want to be part of this this affiliation so we can get these vaccines to us as well. And I believe they're working with like AstraZeneca to get that vaccine out, because AstraZeneca, you keep it in the fridge. So Pfizer needs to be stored very, very cold.
High cold,
very, very cold. Until beyond it to store Pfizer. I worry about like a country like Ghana, Africa, like sub-Saharan Africa. Can they store Pfizer? Because it needs to be really, really cold, to the point that even a lot of physician offices, we give it to the hospitals because we're more that ultra cold storage units. Moderna, so it needs to be kept in the freezer. With the chef fridge, after 30 days, it's no good. After 12 hours, it's no good. But AstraZeneca, they're working on refrigerated COVID vaccine, which I believe would help a lot of like sub-Saharan African countries, so that they can store the vaccines appropriately. That initiative that they're trying to do, 44 countries have said, yes, you can name us. But I saw that Ghana was not part of the countries that can be named. So I don't know if they're part of the other 36 that want to be involved with this initiative. But something like that, it's great, because it's like, yes, we know, so we don't have that large amount of money like these other countries, but let's all come together. Okay, the money we have, and maybe like you guys will take this and you can help us get some vaccines, because Pfizer has said, okay, about 50 million doses of COVID vaccine. Africa is like 1.3 billion people. That 15 million, it doesn't include the second dose. Is it the first dose? And they're saying it's for essential workers, like healthcare workers. Okay, but again, does it include, is it the second dose? Like, it's not enough. Into Africa too, like, we also need to find our way at, we can get these vaccines to our country. And we need to make sure it's a vaccine that is sustainable for our country. Because something that has to be stored ultra cold, like negative 90 degrees Celsius, how are we going to store that? And that's a lot of like, electricity, a lot of power,
a lot of energy.
And exactly. And what about sometimes we might have an issue where there might be like a power outage and then the vaccines are no longer viable. We need temperature monitoring devices. We need so much. And like with Ghana, I know we need so many things. And it's like, Ghana, call me and let me come help you with this. Because I have so many ideas of how we can get this out into the people who need it, which is like the elderly people, the people in the villages. From what I understand, COVID hasn't really hit a lot of like the deep villages, which is great, but let's protect them before, like, what if it gets there? People in the cities, Accra, Kumasi, these people, they all need the vaccines. How are we going to get it to them? Are they all going to come to the hospitals? We need to get out there. And these are all ways that we need to start planning for. We need to start getting the logistics of how this vaccine will go out. If it's going to be refrigerated, we need to educate. How are we going to pack the vaccines? Do we have everything we need to pack these vaccines? How are we going to educate the country to know it's a vaccine and like it's protection? And again, I understand not everyone will want to get the vaccine, but those who want to get it, let's try to boost them more. Let's tell them, so the vaccine, it helps. And that's something that I really think that Ghana, the rest of Africa, we really need to push forward. Like I said, like Africa is so blessed that in this pandemic, you would have thought that because we don't have all the tools, though, it would have wiped out so many people. But thank God it didn't. Like the way that, especially Ghana, like I was so happy to see how like when they started like closing the borders, they knew that we need to protect ourselves because no one else is going to come and protect us. So I was so glad to see that the president was taking so many initiatives to protect the people of Ghana. And I understand people are upset. People didn't understand. But I would rather tell me to stay home for 6 months than rather I go out, catch COVID, and I'm on my deathbed, or I'm severely ill, or I have these side effects that will live with me for the rest of my life. And and especially like they give initiatives like, you know, giving people like free water, access to things, because I feel like if you're telling me to stay home, I can't go to work, you have to work with me. Can you provide some things to me so that I can survive? And once the vaccine comes out and we start rolling it out as well, we need to remind people, wear your masks. I see that people are not wearing masks. Social distancing. I mean, yes, life must go on. People will have weddings, people will have parties, but how can we make it safe so that it's a large space that, you know, we group families together? There's a lot that I believe we can do and we are doing that has helped us to reduce these numbers of COVID. Because like some articles are like, oh wow, like I really thought like Africa, like it would be really bad there compared to these other countries that we say are developed countries.
So you think for Ghana specifically, the initiative by the government, the quick reaction has helped to reduce the figures?
I believe so. I believe that they were like, you know what, like
Very
I said,
proactive.
Very proactive, because we have to be honest. When it comes to Africa, no one is really looking out for Africa. They be like they think that there's nothing there. We can figure things out because so shit the way I like US or more allies all over. We need to go help them. Boom boom. But if something happens to Africa, there are allies, but it's like it doesn't hit as hard as like these other, as they say, developed countries, how they have each other's back. Africa needs to have its own back. And if we need to find a way to work with manufacturers one-on-one, let's do it. Let's figure out a way to say, you know what, you charge $5 a dose for your vaccines. What if we do like $3 a dose for the vaccine, but we know we said we're only going to get it from you and you supply like all of us with the vaccine. We need to find ways to work with these other manufacturers and also see how we're going to, again, like store these vaccines, handle these vaccines, because my fear is we will get the vaccines, but how will we get it out? How will we store it? We need people to really take control of the vaccines and know, okay, this city, 25,000, we're going to have about 20,000 vaccines ready to go. If you want it, you come get it. But let's say only 10,000 people come and now we have so many vaccines left. How are we going to transfer to another site that they need the vaccines as well? Because we need to make sure we're giving it to the people who want it. But again, I don't feel that, you know, we have to make the vaccines mandatory.
So all the way from Fanti, we are there. What will you tell the government, looking at what is happening from the data you have from your office? What will you tell your government, that the government of Ghana and the people of Ghana?
Definitely, I think that they need to be proactive. The measures that they took early on to protect the citizens of Ghana against coronavirus, they need to continue that. They don't have to lessen any policies because of politics, because of the economy. We need to be concerned about the people. And I just hope that they will continue with those proactive measures that they started off with and continue to help the people of Ghana understand that COVID is still there. There are new strains coming out. We need to understand these strains. There are vaccines coming out. We need to figure out a way how we will get these to our people as well. So I think that the country should instill hope in their people and let them know that we will fight this. We will find a way to reduce these numbers, to get COVID out of our country. And as long as we have God by our side, we have scientists with us, we will be able to get this down.
So if the presidency should reach out to your office, that Michelle, with all your experience, you have been on the front line, you have been there, you are now distributing the vaccine, you have a lot of knowledge about this vaccine. If the presidency should reach out, we need you to help us, on advice, especially with the new, strains coming up and all that. Are you ready?
I'm ever more than ready. I'm helping to serve my country here in America. I also need to serve my country back home in Ghana.
Michelle Braimah, thank you.
Thank you so much for having me.